Assalamu alaikum everyone and welcome back to yet another informative video. As always, if you enjoy our videos, make sure that you are subscribed to our channel and make sure that you turn the notifications on so whenever we upload a video, you get to know about it right away. As you know, in this video series, we try to educate the deaf community about the dangers of COVID and relay information about the virus that might not be accessible for the deaf community. Keeping that in mind, today we are going to share with you the long-term effects of the COVID-19 and some tips on what you can do to recover. All of the links are in the description below if you want to check them out. Now let's get started. COVID-19 long-term effects. COVID-19 symptoms can sometimes persist for months. The virus can damage the lungs, heart, and brain, which increases the risk of long-term health problems. Most people who have coronavirus disease recover completely within a few weeks. But some people, even those who had mild versions of the disease, continue to experience symptoms after their initial recovery. This condition has been called Post-Covid-19 Syndrome or long COVID-19. Older people and people with many serious medical conditions are the most likely to experience lingering COVID-19. But even young, otherwise healthy people can feel unwell for weeks to months after infections. The most common signs and symptoms that linger over time include fatigue, shortness of breath, cough, joint pain, chest pain, and other long-term signs and symptoms may include muscle pain or headache, fast or pounding heartbeat, loss of taste or smell, memory, concentration or sleep problems, rash or hair loss. Although COVID-19 is seen as a disease that primarily affects the lungs, it can damage many other organs as well. This organ damage may increase the risk of long-term health problems. Organs that may be affected by the COVID-19 include heart. Image tests taken months after recovery from COVID-19 have shown lasting damage to the heart muscle, even in people who experienced only mild COVID-19 symptoms. This may increase the risk of heart failure or other heart complications in the future. Lungs. The type of pneumonia often associated with COVID-19 can cause long-standing damage to the tiny air sacs in the lungs. The resulting scar tissue can lead to long-term breathing problems. Brain. Even in young people, COVID-19 can cause strokes, seizures, and a condition that causes temporarily paralysis. COVID-19 may also increase the risk of developing Parkinson's disease and Alzheimer's disease. Blood clots and blood vessels problems. COVID-19 can make blood cells more likely to clump up and form clots. While large clots can cause heart attacks and strokes, much of the heart damage caused by the COVID-19 is believed to stem from very small clots that block tiny blood vessels in the heart muscle. Other parts of the body affected by blood clots include lungs, legs, liver, and kidneys. COVID-19 can also weaken blood vessels and cause them to leak, which contributes to potentially long-lasting problems with the liver and kidneys. Problems with mood and fatigue. People who have severe symptoms of COVID-19 often have to be treated in a hospital's intensive care unit with mechanical assistance such as ventilators to breathe. Simply surviving this experience can make a person more likely to later develop post-traumatic stress syndrome, depression, and anxiety. Many people who have recovered from SARS, have gone on to develop chronic fatigue syndrome, a complex disorder characterized by extreme fatigue that worsens with physical or mental activity, but it doesn't improve with rest. The same may be true for people who have had COVID-19. Much is still unknown about how COVID-19 will affect people over time. However, researchers recommend that doctors closely monitor people who have had COVID-19 to see how their organs are functioning after recovery. Many large medical centers are opening specialized clinics to provide care for people who have persistent symptoms or related illnesses after they recover from COVID-19. It's important to remember that most people who have COVID-19 recover quickly. But the potentially long-lasting problems from COVID-19 make it even more important to reduce the spread of the disease by following precautions such as wearing masks, avoiding crowds, and keeping your hands clean. We hope that you found this video informative. If you did, please like the video, subscribe to our channel, and turn on the notification. Till next time, bye-bye.